to come together and think about ideas that are going to benefit everyone in the state, all 7.2 million residents, and the way that we manage emergency medical services through the Office of Emergency Medical Services and through the state's power, but then also think of ways that we can use waivers and we can use exceptions to some of the regulatory barriers so that small towns and rural areas can get what they need. This is very different if you have a town of 150 people than if you have a city of 1.2 million people. Right? Just very different needs that you have out here, and your base of volunteers, your base of paid professionals are very different out here in the Berkshires than they are when we get over to eastern Massachusetts. I will say one other thing before I open this up, because I really do want to hear from you, which is that I challenged the director of the Office of Emergency Medical Services this year, along with her supervisor, the director of the Bureau for Healthcare Safety and Quality, to work collaboratively with people across the state to identify what we think is the ideal emergency medical system for Massachusetts. I think that we actually have buy-in on the executive branch side and the legislative branch side to take action and to change things. So I know a lot of folks oftentimes feel like people from the state come out here and you say things and we don't listen or we don't take action. I want you to know that I'm listening today. We want to take action. I think we have the political will to take action. And also, you probably know this better than anyone, action in government is slow at times. So please bear with us as we try to accumulate what we learn from you here in the Berkshires, from what we're learning from folks in Central Mass, what we're learning from folks in Southeastern Mass, out on the Cape, and what we're trying to bring to Beacon Hill as we try to move forward with the necessary changes to the system.
So I would love to just kind of open it up.